Elina here. Today I'm going to show you a sequence for back pain specifically, low back pain. And if you know my story, I was diagnosed 10 years ago with a spinal condition called ankylosing spondylitis, and I also herniated 2 discs in my low back. So yes, these are some of the moves that I have found really helpful. Of course, always consult your doctor before doing any exercise, and I am not a doctor, so just make sure that you listen to your body and really don't push through pain. And if you feel any pain or any burning or stabbing, shooting sensation, just stop. What you'll need today is a yoga strap, or you can use a dog leash or a like a bathrobe belt, or you can use a even a long towel or a long sleeve shirt or something like that. So have that handy, and then something soft to lay on. We'll spend a lot of time on our back today, and so just make sure that you have either on carpet or a yoga mat, maybe pad with a blanket if that feels good. Just be really comfortable, right? All right, so we will get started on our backs. And just start off, knees bent, feet on the floor, knees can knock in together. You can place your right hand on your low belly, left hand on your heart. Just close down your eyes here for a moment. Just breathe in and out through your nose. See if you can pay attention to the areas of your body that's touching the ground beneath you, whether you're on a yoga mat or carpet or wherever it might be. Just pay attention to where your skin touches whatever surface you're on. Maybe notice the areas of your body where your clothes touch your skin. Or maybe even the areas where the air touches your skin. Living with back pain can feel really isolating, very lonely, hopeless at times. But you're not alone. And it will get better. It's easy to get frustrated with our bodies and angry. But if we can come from a place of compassion and kindness towards our body, maybe even love it despite all its limitations, we can start cultivating a better and deeper relationship with our body. And maybe even start to have a bit of a conversation with it and really learn how to listen. Slowly blink open your eyes. Bring your knees into your chest, just gently here. Give yourself a bit of a hug. No yanking, no pulling, no excessive force here. We're just moving mindfully, very gently and loving. If it feels good, you can roll your legs around a little bit like this. If this hurts your sacrum, you can pat it with a blanket, perhaps, or just stay still if that feels better for you. Come to center. With your knees bent, bring your left knee into your chest and gently grab hold of it and move it around a little bit. Again, no yanking here. We're just gently kind of hugging our body, right? Just getting used to moving in this mindful way versus just rushing from place to place. And release that. And then lift your right knee into your chest. And again, just gentle movement here. Or you can stay, you can hold it still, whatever feels good for you here. Maybe you find a spot where there's more sensation. Maybe spots where there are less sensations. Again, just very gently here, right? Just want to kind of explore a little bit. With no judgments. And again, if anything is painful, just stop. Place that foot down. From here, grab your strap. Place it around the sole of your left foot. Now, this, if you have a disc herniation in your low back, this can be a little bit triggering. So I want you to be really careful here. You might stay down here. So what we're trying to do is stretch our hamstrings and the back of our legs. So perhaps you are here, or maybe even closer. This is my end range. Or maybe you're here. If you're here, that's great. Just kind of stay here, hold on to the strap for gentle support. Again, no yanking here, but just kind of hold wherever you feel a stretch alongside your, in your Achilles tendon, your calf, the back of your leg. I don't want you to feel any sort of shooting pain in your low back here. Just nice and easy, just breathe here. If it feels good for you, you can straighten your other leg. Now that doesn't feel great for me, so I'm going to keep mine bent, but you go ahead and play around with whatever feels good for you. And again, you might not need the strap here. Perhaps you can reach your foot or reach your calf, and you can go ahead and do that. Just breathe here. Nice and easy. Release your jaw. Release your eyebrows. Release your shoulders and your neck. Just no tension here. It's just yoga. And when you're ready, slowly lower that down and we'll switch sides. So strap or belt, whatever you're using, goes around the sole of your right foot. And again, perhaps you're down here, maybe start down here and then slowly work your way up to see where your end range is. So mine is here on my right leg. So I have disc herniations that affects my right side. So I have very limited mobility here on this side. It gets a little bit better when I keep that bottom leg bent. But still, this is where I am, and that's great. So wherever you are is perfect. Just relax here. Try to release your shoulders, release your jaw, release your eyebrows. See if you can send your breath. Imagine that you're sending your breath into your hamstring and the back of your leg here, your calf muscle, maybe even your Achilles tendon. Nice and easy. Just breathe deeply here. Release that when you're ready. And place that to the side. Give yourself a bit of a hug here again. Just wiggle around, whatever feels good here. Maybe you windshield wiper your legs a little bit side to side if that feels good. Be careful here if you have any SI issues. Maybe this aggravates it, then just don't do this. Place your feet about hips distance apart, soles of the feet are down. Knees are bent. See if you can find your hip points. See if you can kind of place your finger on your hip points here. So that's the front of your pelvis. Now imagine that your pelvis is a bowl and you're tilting it backwards. I don't know if you can see this, but it's tilting backwards. So your low back will be pressing into the mat or carpet, whatever you're on, and your hip bones will go down and kind of upwards. So you can almost imagine that you're trying to pull your bottom ribs and your hip bones together, right? Kind of closing that off. So just go here at your own pace, just kind of back and forth a little bit, finding very gentle movement here. Again, very gentle. Inhale as you come to neutral. Exhale as you tilt. Inhale, neutral. Exhale, tilt. Just very gentle movement here. Trying to get a little bit of mobility through the pelvis. Come to center. We'll go back to those, but I want to add on something. So we'll engage our pelvic floor at the same time now. So for us girls, that's basically a Kegel exercise, right? So imagine that you are holding in your pee midstream. That's one way of kind of engaging it. So imagine that you are drawing in and upwards from the base of your spine, right? So all the way down from the base of your spine, draw in and up, and then as you do that, tilt your pelvis and press that low back into the ground. Very gentle here, very gentle, nothing forceful. And let that go. And one more time. Engage that pelvic floor, draw it in and up. It's a Kegel exercise here. Press your low back into the floor and release. And one more time. So these can be really good to do just by themselves. It's often an exercise that I've done in physical therapy to strengthen my pelvic floor and my deepest layers of core muscles. You just keep going here at kind of your own pace, right? And if it helps, just keep your fingers on your hip bones here, just feeling it kind of tilt. Can be helpful sometimes. Do a couple more here. Tilt, press the low back into the mat, really engage through that pelvic floor, and then let it all go. Come back to neutral, release the muscles. And then one more time. Engage your pelvic floor, tilt the pelvis, press the low back into the ground, and release. Let's do one more. So engage the pelvic floor, tilt the pelvis, press the low back into the floor, and let it go. And here you can, again, wiggle it out as needed. Take any movement that feels good. Now, a strong core is really important if you have any sort of low back pain. So we'll do some gentle core strengthening here. So I'll show you modification as well. So we'll do toe taps. So you're going to be in tabletop like this, and then we'll tap our toes down to the mat. Now, if that's too much for you, you can stay right here, and then you just lift one leg at a time. Another tip to make this a little bit harder, if this is too easy but the tabletop is too hard, you can add ankle weights here. So we'll go, I'm going to do these here. So be in tabletop, this is tabletop position. Really press down through your low back is pressing into the ground. You really want to engage those pelvic floor muscles here, right? That Kegel exercise that we talked about. Imagine holding in your pee. And this is pretty hard, just staying right here. It's pretty difficult. So from here, Inhale as you lower one foot down. Exhale, come back up. Inhale. You can even make that little sound as you come up. Kind of forcefully exhale, as it will help you engage the proper muscles here. And again, if this feels easy, you can again add ankle weights, or you can also add your arms. So you can make this into a dead bug, where you just move opposite leg and opposite arm. Ooh, that's really hard. I'm gonna stay here. Let's do a few more here. Really make sure that that low back is pressed into the ground. You do not want to have the pelvis move around here. So the pelvis is very steady. It's not moving, it's just your legs moving. So no rocking. You're not doing this here, right? None of that. That's not going to feel so good. You're staying completely pressed into the mat. One more. Ooh, oh, I feel that. I hope you are too, in a good way. That burns. Those are also really good to do to strengthen your core. And again, if they're too much, then you just do the leg lifts like this. Ooh, okay, from here, we'll do a little bit of a stretch. And you can grab a block, a yoga block if you have one, or a pillow, or a stack of books, or really anything that's about this height. You may not need it, but just see how it feels. So keep your legs, keep your knees bent, feet flat on the floor, and then take your right leg externally rotated and take the toes of the right foot behind the left ankle, so kind of hooking on there. If this is too much, this really opens up through the hip here. If this is too much, this is where you can use the block and just place it right there, or even closer. Prop yourself up as much as needed. If this doesn't feel great, you can also just take it as a kind of a supine tree pose here. So you would straighten out your bottom leg and then just keep your right knee bent and just lay it over to the side. Just breathe here. Feel that opening through the hips. Just breathe. Notice any sensations. If it's painful, back out, but if it's not painful, just surrender to it. Inhale, bring that leg up. We'll do the same on the second side. So your left toes hook behind the right ankle, and that left knee comes out. Again, if this is too much, you can grab a block and place it under your knee. Be mindful here, especially if you have any sort of knee issue. You can also take this as a supine tree pose, so you can straighten out your right leg and then place your right foot against the inside of your right leg. It's a nice way to open up the hips here, kind of that front core. Breathe here. Notice any sensations. Inhale. Bring that foot up. You can hug your knees into your chest again. From here, roll over to your right side. Slowly make your up to a seat, we're coming into tabletop position. If this is too much for you, you can end the video here and just do that first part for the time being. But if this feels okay, we'll meet in tabletop, so hands are underneath the shoulders, knees underneath the hips. Start off with some cat-cows here. So inhale, drop the belly, tilt your tailbone up, and gently gaze upward. Exhale, round and curl. Again, very gently here, very gentle. Just getting a little bit of mobility here through the spine. Be very mindful of how this feels. If you feel any, again, kind of stabbing or burning or shooting sensations, just lay off, right? Just stop it and listen to your body. And we'll meet back at center. From here we'll go into dancing lions. So we just kind of do big circles like this. This is kind of warming up through the wrist joint, shoulder joint, hip joint. You can take as big or small of a circle as you'd like. Just find any movement that feels good here. Make sure to keep that core engaged. Draw that belly button to the spine here to really support that low back. And switch directions. Just roll to the other side. Beautiful. From here, come back to center. Lift your right leg and your left arm. This is balancing tabletop. Again, your spine here is neutral or as straight as possible. So here you don't want to do this, right? Keep that spine straight by engaging through your core. Draw that belly button towards the spine, lifting your leg through your glute, right? You're not lifting by extending your spine. You're lifting from the glutes. Breathe here. Good. Let's come on down, switch sides. Again, engage through that core. Lift through the glute. Really reach here. Imagine that you're trying to touch your toes to the wall behind you and touch your fingers to a wall in front of you. Good. And switch. This is almost like that dead bug I showed you in a way, but just on our hands and knees. It's a really good core exercise. And switch. Just helps strengthen everything throughout your core. Draw that belly button towards the spine. Get long here. Think length versus height. Does that make sense? And come here. Let's do one more each side. Hold it. Hold it a little bit longer. And come on down. And last one. Left leg back, right arm forward. Belly button drawing towards the spine. Neck is long. Gaze is down. Really reach through those fingertips and those toes. Hold a little bit longer. You got this. And come on down. Good job. Come back to sit on your heels. If this is uncomfortable, you can grab just a little tip here. You can grab a blanket or a pillow or something and place underneath your hips. You can prop yourself up as high as you need to here. It'll help decrease the angle in your hips and your knees. So if you ever have a problem sitting like this, that could be something to try. Okay, from here, You may want to grab onto something that you can help you balance if you have balance issues. So if you want to hold you know, a wall or a chair or anything like that, might be helpful here. You can also pad your back knee here. So we're going into a version of a low lunge, but we're going to keep it pretty gentle. But again, if this hurts you, just stop, just listen to your body. So low lunge, typically we go this way, right? Today we're staying in this 90-90 angle with our legs. That will help us keep our spine in a more neutral position. So we don't, this ends up being a back bend, which doesn't always feel great. So that's why I want to do this one today. So pad your back knee as needed. Be in this kind of 90-90 position with the legs. You can hold on to a wall or a chair or anything like that for balance. Now again, imagine your pelvis being a bowl, right? It's a bowl of water, and you're trying to tilt that water backwards. You're trying to make it spill out of the back. So you want to tilt your pelvis, you're drawing the tailbone underneath you. Again, gently here. Don't yank, don't force anything, just see how that feels. Tilt it and see if you can feel that stretch in the front hip flexor here. And stay here, just breathe. This might be enough for you. You can play around with lifting up your arms or not. And of course, if you want to take a full low lunge, you can, but I just want to show this version here for anyone that has sensitivities in the low back and where back bending doesn't feel great. Breathe here. You're doing great. And slowly come out of that. Place your left knee down, and we'll do the same thing on this side. So again, knees are in a 90-90 angle, and we'll take that pelvis and we will tilt it so that we're tucking the tailbone, trying to spill that water out of the back here. And you should really feel that here. I know I am. You can keep your hands on anything needed for balance. Also, if you engage slightly through your left glute, it can help to really stretch the front here. So just a little bit of a kind of, it's the opposite muscle, which helps stretch whatever's on the other side. But again, just really gentle here. We're just exploring, seeing how this feels, right? This is not saying that you have to do these movements or that these should, you know, be the end all be all, or that this is going to help everyone. That's absolutely not the idea here. It's just some gentle movement, exploring what feels good, what maybe doesn't feel so good, and then just, you know, listen to our body and developing a good, solid relationship with it. Okay, I feel that. All right, and then slowly come out of that. Maybe you want to sit back again. Just take a moment. Okay, from here, coming onto our belly. Now, if you have sensitivity in your low back, or if you have ankylosing spondylitis with fusion or any sort of reason for that you can't be on your tummy comfortably, feel free to prop yourself up as much as needed, right? So you can place blankets, bolsters, anything you need underneath your chest or shoulders, your hips, whatever you need. And we will come on to our belly. You can cross your forearms in front of you and just lower your forehead down. This is called crocodile pose here. And if this is enough, you can stay here. So this is an invitation. Maybe this feels really good. If you want to add on, you can come with me and we will do some half locust lifts. So your arms are by your side, palms facing upward. Legs are pressing into the floor. Belly button is drawing towards the spine. Again, you're kind of tilting your pelvis so that you're tucking your tailbone under. really pressing your pubic bone into the mat. And from here, inhale and rise up. Really good for your back muscles here. Breathe. And come on down. Shake out the hips a little bit if needed. Just wiggle a little bit back and forth. We'll do that again, or you can stay right here. So take whatever feels good for you. If you want to come to these half locust lifts with me, remember to press your pubic bone into the mat. Really tilt that pelvis so that you're tucking the tailbone. Inhale, come up. So your arms are reaching back towards the wall behind you. Lifting through the upper body here, really feeling those shoulder blades drawing in together. Engaging through those big, strong back muscles. Holding you up here. One more breath. You got this. And come on down. Good job. From here, if you want, you can play around a full locust pose, which would simply be, you can either stay in crocodile, you can do the half lotus like we just did 2 times, or you can come with me into a full lotus, which basically just means that we lift the legs and the upper body. Really squeeze the glutes here, press that pubic bone into the mats. Back muscles are strong, they're really extending your spine here. And come on down. Good job, good job. From here, slowly make your way up, and we're coming back onto our backs again. Very gently, just moving mindfully, always engaging that core. Really think about always drawing that belly button towards the spine. Practice those pelvic tilts and get those kegels going, ladies. It will really help with your low back stability. So it's really good if you have any sort of low back pain. From here, coming into Shavasana, which is our final resting pose in yoga. We always finish class here. Your knees can be bent and knocked together. It's a very nice restorative pose here. Or you can place a rolled up blanket or a pillow or a bolster or something underneath your knees. That's option 2. Like this. Or option 3, which I'm going to show you because it's a really yummy one, especially if you have back pain, is to use a chair. Take a chair. You can do this against the couch, obviously, or anything that you have. Pad. I'm going to pad this just because it's kind of a plastic chair and it's not super soft to lay my legs on. But okay, so from here, just place your calves right up on the chair. This is a very, very restorative and releasing pose for your low back, because here it's completely just neutralized. There's no pressure on it, no weird angles. If you want, you can put a pillow or a blanket underneath your head here. So take whichever Shavasana variation that feels best for you. Play around with it. Maybe you prefer the bent knees and the knees knocking in. Great. Maybe you like just having something underneath your knees, or maybe you like this one. You pick whichever one feels good for you. Arms by your side, palms facing upward. You can snuggle your shoulder blades in a little bit. Close down your eyes. And let's take a deep inhale through your nose. Hold at the top and exhale through the mouth. Sigh it out. Let it all go. Just be here in your body, noticing any sensations without judgment. Maybe you felt energized today. Or maybe you felt tired and sluggish and everything just hurt. Wherever you were, it's okay. Sometimes when we move our bodies, it feels really good, and then try to do it again the next day and it feels awful. And you're just not in it, and you're just tired. And that's okay, it's part of the whole journey. That's why it's called a yoga practice. So if you're going through a lot of pain, a lot of limitations in your body, see if you can invite compassion, kindness, and love towards your body. And let them take the place of any anger, frustration, and maybe even hate. Just see how that shift changes the relationship you have with your body. Our body's whole purpose is to keep us alive. And they're doing the best they can. Even if it doesn't always feel like it, right? Especially if you have an autoimmune condition or anything like that, it can feel really frustrating. But again, just be thankful for your body and everything that it does do for you every day. Feel free to stay here as long as you'd like. You can pause the video. Or if you feel ready, slowly blink open your eyes. Wiggle your fingers and toes. Hug your knees into your chest. And be mindful of any props you have on your mat. If you have a chair, for example, be careful not to knock it over. When you're ready, slowly roll over to your side. Stay here for a moment. And inhale, come back up to a seat. And if this is hard, by the way, to sit like this, you can sit on a chair. Sitting on a block tends to help me a lot. And kind of imagining that you tilt your pelvis forward. So we've talked a lot today about tilting your pelvis backward, but when you're sitting, and especially if you have, for example, disc herniations in your low back, it can be really helpful to tilt your pelvis forward when you sit. So really grounding down through your sit bones. So I know for me, I couldn't sit properly for, took me years. But sitting like this typically helps alleviate some of that pain for me, at least. So play around it, see how it feels. Sit up as much as you need to, really ground down through the sit bones, tilt your pelvis forward, and see if that can give you some relief. Thank you so much for practicing with me today, Again, if you are going through back pain, I feel you, I see you. It is very challenging. It's not forever, and you are not alone. Thank you for practicing with me today. I'm honored. Namaste.